Doc Zen talking joint pain, arthritis, all that stuff at 8:31. Doc?
So here's the worst thing about arthritis is that it will eventually stop whatever activity you enjoy. Whether it's gardening, sewing, exercising, playing with the grandkids, it's an activity killer. And when your activity stops, the rest of your health usually goes downhill fast because of inactivity. So arthritis in a knee that keeps you from walking now affects your heart health, your weight, your blood pressure, and on, the rest of your health. So since having a good long life depends on our joints working correctly so that we can have plenty of activity, arthritis in one joint, I don't care if it's a foot or a knee, can affect every other aspect of your health, and then that part of your health will start to go downhill rapidly as well.
So if you start compensating for, say, a hurt ankle, you start compensating, you could actually blow out another part of your body because of it.
Right. Absolutely. So if you're compensating on one side, then you start having other structural problems as well.
Got it.
Or if you stop walking because your knee hurts you, and then you start gaining weight, develop high blood pressure, cardiovascular problems, well, that knee just caused you to have, weight problems, heart problems, everything else, because you didn't get the activity that you would have had we have taken better care of the knee. So, this is a wide-reaching problem, and there's so many people out there that have it. And so arthritis has many names: joint deterioration, joint degeneration, spurs, thinning of the joints, joints that have been called, quote, bone on bone. All of these names are referring to arthritis, which, by the way, I've interviewed a lot of patients in the last 18 years. In fact, almost 10,000 of them. And I have patients tell me at least 3 times a week that they've been told they have, quote, bone on bone. And listen, I've checked hundreds of these cases, and I have never found one that is actually bone rubbing on bone in 18 years. I'm not saying that it never happens, but I've never found one. And I hear people say they've been told that all the time. If you really had bone rubbing on bone, you probably would not be walking around. So I'm not saying it never happens. I'm just saying that term is way, way overused. No, doc, I have bone on bone. You can't help my knee. So even if you've been told you have, quote, bone on bone, don't write yourself off and think that there is no hope outside of surgery. There are things that may actually help you. So someone that's in the beginning stages of joint problems needs to think down the road. Imagine how you're going to be 15 years from now. Will you be doing all your activities, or will you be stuck in the house using a walker or a cane or having joint replacement surgery? Or would you rather put a really great program in place now to avoid all of that and to stay healthy and functional? So my program, Extinguishing the Fire in Your Joints, is a program that couples the 4 best natural treatments for arthritis and joint pain and has put them together in one very effective order. And we do them all together as part of a comprehensive program. It's really unlike anything else that I've ever heard of or that's ever been out there. So we're going to go to the Hilton Garden Inn on March the 5th, and I'm going to take participants through a simple explanation, start to finish, of how joints develop arthritis, and this will help you avoid the few activities that may be contributing to your advancement of your arthritis. We're going to go through simple things that you can do at home to treat these areas yourself, and then we're going to go through some of these new technological advances in non-drug, non-surgical treatment of joints. So if your joints hurt when the weather changes, if you limp around with knee pain, or you have hand pain, or you're developing nodules in your knuckles, or if your shoulders hurt and make noise in the morning, these kind of things, you should really pay attention to these things and get some help now before it becomes too late and you have to try to fix it with joint replacement. Which, by the way, speaking of joint replacement, those things only last so many years. So if you're, say, younger than 65 years old and your joint replacement only lasts 10 or 15 years, you may actually get in a situation where you have outlived your joint replacement.
And they're doing them so early now on people.
Right. That's what we're trying to prevent. So with this program, we can actually extend a patient from having to have that surgery, sometimes for years. So the idea is, yes, you may still need that knee replacement, but if we can postpone it a decade and you have it at 70 instead of 60, we can make a tremendous difference in how it's going to be 10 years or 20 years later. And, you know, sometimes people say, oh, well, I'll be 85. I won't, I probably won't be around then. You very well might. People, you know, we may actually all break 100 by that time. You know, with medical advances, people that are 80 right now, their life expectancy was 51 when they were born. So that means that yes, you very well might break 100. So you know, don't write yourself off as that's not going to happen. So you want to take in your 60s the best care of it you possibly can. So my main point here today is that arthritis does not have to be a life-altering problem anymore. If those that have joint pain will just take an hour out of their life to come see this program, you will be amazed at some of the natural advancements that we have in non-drug, non-surgical treatment for joints. So we are accepting reservations now. The number is 837-7174. You can call and book your seat now before the room fills up. It's going to be March 5th at 7 p.m. at the Hilton Garden Inn. And so, guys, I want y'all to come and hear about this. I've been working on this program behind the scenes for quite some time. It is going to be quite remarkable. It's 837-7174 to call and register. Now, next week's show, I'm going to go into some details about the different forms of arthritis and what to watch for on how to protect each area of your joints. So in other words, how do you protect your knees? How do you protect your hands? And so we're going to go through each area of the body and some different aspects of arthritis and things to watch for. But call and register now. Don't wait till next week because the room may be full. It's 837-7174.
Thank you, Doc.
You bet. I'll see you guys next week.
Bryant Wellness Institute of Acadiana, you guys are also on Facebook?
Yes, on Facebook at the Bryant Wellness Institutes, and we'll post it up there today, too. If you missed any of the registration numbers, we'll post it at the Bryant Wellness Institute's Facebook as well.
Wellness Wednesday on KTDY.